As providers, it's difficult to recognize if a patient has financial needs. Can they afford what I'm recommending? Can they afford the visit follow-ups? To have the patient assistance fund and access to it eliminates the barriers that some patients have while others don't. So we ensure that all patients are getting adequate care that they need.
By having a patient assistance fund that would help make that patient's journey a little bit easier, a little bit less financially stressful, can really end up being the difference between them actually seeking care and going through with that care plan, or choosing to avoid that problem for some amount of time because some other aspect of their life has a higher financial impact. And so it's been really exciting to have an in-house patient assistant fund that would allow us to make a referral to our financial programs to see if we can offer any services that may help that patient get through a very difficult time if they've had an injury or other musculoskeletal problem.
Patient assistance funds can be used for things such as transportation, medication regimens, or even medication to prep for treatment. And we've had situations where we can get really unique with those funds and use them to help patients move out of maybe an unsafe situation that they might be in, access to clothes that they might not have, or food. Just different areas that they have needs, we can use those funds for. Personally, I have had 2 patients that I have been working with that I've been able to provide gas gift cards to, and I was unaware of how that was going to impact these 2 patients. One of the patients is going through a really difficult and life-altering time right now, and she cried over a small gesture of being given gas cards and impacted my heart more than I thought it would. Another patient, Mario, that I have been working with has had a long journey of working towards being healthy due to his diabetes and life-altering procedures that he has had. So in providing him these gift cards, he was completely re-energized and motivated to follow through with care. These are his exact words: that without the gas cards and resource for a ride, because I'm used to using a bus system and trained, which we do not have in our small rural community, and my family travels over a couple hours to help, that I truly appreciated the help so much, more than you could ever know. It's a small gesture for us to be able to show patients that we see them, we hear them, and that we can help.
It means meeting our health needs for our patients and not having barriers and obstacles to get them to their healthiest self.
This particular fund is really going right back to the patients that we care for, and so I think it's something that we can all relate to, regardless of what our department or specialty is or what type of healthcare provider we are throughout the system. It really all comes down to all of us are here to take care of patients.
I would say it is one of my favorite parts of my jobs when I can access those funds and be able to impact someone's daily lifestyle so that they can meet their goals and strive to be a better version of themselves.